My name is Dr. Irene Mbwavi. I'm a pediatric cardiologist currently based at Avenue Hospital. Pediatric cardiology is a field of medicine. We are able to diagnose and treat children who present to us with different kinds of heart problems. There are many types of heart problems that we see. We have the congenital ones and the acquired ones. Congenital means conditions which a child is born with. And the one that is commonly known to us is the holes in the heart. The acquired ones, it's very common, is rheumatic heart disease. It's a complication of rheumatic fever. Children will present in different ways whenever they have any heart problem. Among the symptoms, this includes fainting episodes or even convulsions. Then there are those who they get tired very easily and therefore they end up squatting even just after walking for a very short distance. And there are those who will present with difficulties in breathing or even fast breathing, and as a result, there'll be interrupted feeding episodes. For the older children, they might come to us with complaints of chest pain, fast heartbeats, or even irregular heartbeats. Then there are those who present to us with complaints of blueness around the lips, around the tongue, and also around the fingernails. There are those who will present to us with swelling of the legs or swelling of the abdomen. And these are all pointers that there's a probability that a child could be having a heart problem. In terms of the causes, again, there are very many causes for these congenital heart problems. One of them is infection, and the most common one that we see is rubella. If a mom is pregnant and has not been diagnosed or treated for rubella, then there's a very high likelihood that the child who will be born will have a congenital heart defect. Sometimes problems go from one generation to the other. So in case there is a family history, then the likelihood is high that the child could have heart problems. There are some medications that we might prescribe for one reason or the other. And a good example is sodium valproate, which is sometimes prescribed for epilepsy. If a mom is on this and ends up conceiving, then sometimes we can get children who are born with heart conditions. Moms who have uncontrolled diabetes might end up with children who are found to have some of these heart problems. Sometimes the diet is low in micronutrients like folate. Then again, it increases the risks of a child getting these congenital heart problems. There are these chromosomal disorders which are associated with congenital lesions, for instance, Down syndrome, Williams syndrome, Turner syndrome, among many others. When we see these children, then we have to do something about it. So modes of management include medical management. So there are some conditions which we straightforward treat with medications and the children improve. However, there are those conditions which might require surgery and sometimes open heart surgery for us to correct, especially the holes in the heart. So we have the minimally invasive procedures that we do in a special lab called catheterization lab. This is where we use catheters or tubes. We are able to access one of the veins through the groin, and we take the tube right into the heart. And using that tube, we are able to do many procedures, for instance, closing the holes or even treating some valves which are not normal. Sometimes we use implantable devices, for instance, pacemakers, to be able to correct the heart rates in these children. Sometimes we get some very complicated heart lesions which cannot be treated by all the ways that I've talked about. And in this case, then we may require heart transplant. We run a pediatric cardiology clinic at Avenue Hospital, Parklands, every day from Monday to Friday between 9 a.m. and 5 p.m. You're all welcome.